Hi everyone, my name is Rebecca Thomas and this is my presentation on the Williams Consent Decree, Processes, Outcomes, and Impact. I'm not sure if everyone got a chance to read the literature review I posted, but I briefly identified the difficulties that many people with mental illness face in Illinois when trying to secure supportive housing as well as other services in the community. The reason I chose this topic is because I've worked with adults with mental illness for about 7 years now, and over those years I have seen how the many budget cuts, gaps in services, policy changes, and other issues surrounding mental health care in Illinois have affected them. And the Williams Consent Decree is one of these changes which affected numerous residents with mental illness in Illinois. It all started with the Williams versus Quinn. In 2005, a class action lawsuit was filed against the state of Illinois on behalf of individuals with mental illness who lived in psychiatric facilities, or IMDs as they're referred to now. This lawsuit is called Williams versus Quinn, and the primary points identified in the lawsuit included the state of Illinois being in violation of guidelines under the American Disabilities Act, as well as Section 504 of the Rehabilitation Act. So basically, they're just claiming that the state of Illinois unnecessarily houses individuals with mental illness as a means to segregate them from others in the community. In 2010, Illinois entered a consent decree settling the Williams versus Quinn lawsuit. This consent is called the Williams Consent Decree and was established to provide more integrated housing in the community. It basically states that all persons with serious mental illness currently residing in IMDs in Illinois have the right to choose to live in community-based settings, as well as the state has an obligation to expand the current community-based services that are provided for these individuals. The primary established process and plans to be implemented in the decree include first identifying which individuals meet the criteria, which are basically those who have been given a psychiatric diagnosis and currently live in an IMD in Illinois. Community caseworkers are appointed to go and visit these IMDs and meet with the residents that live there and provide them with all the information regarding alternative living and services to help them in the community if they so to choose to move to the community. Assessments are then conducted for those who express interest to determine if they are suitable for independent living in the community. These assessments include anything from specific level of functioning, any assessments of risk indicators, psychosocial assessments, or any other assessments to determine their behaviors and any issues that they might see about living independently. If deemed appropriate, that individual is set up with a community outreach team to assist in the process of finding an adequate residence and securing services in the community to assist them. They help them with anything from getting a link card to getting free bus passes, vouchers for furniture, setting them up with group therapy in the area if they would benefit from that. And then following discharge from the IMD and moving into their new residence, each individual is to receive frequent, consistent follow-up visits from their team to ensure they are adapting properly and abiding by the rules. So the teams are to follow up, if not every other day, then at least once a week, depending on how that person is doing, and just kind of look for any changes in behavior, any possible issues, anything against the rules such as substance abuse or conditions of the home to make sure that they're living in safe, healthy conditions. And then the implementation of this plan is to be reviewed annually, taking into account reports from mental health workers in the community, those in this program, family members of those in this program, and then those are all supposed to be taken into account for the review. So what has been the outcome of the Williams Consent Decree? The plans established by the decree sound ideal, and there have been some success stories of individuals returning to the community and doing well. However, the plans of the decree appear to be lacking in several areas. First of all, there's not enough mental health workers to follow up as necessary. So home visits are not occurring as often as they should, and these individuals are not receiving the support that they need, which obviously causes some serious issues there. The evaluation process is flawed because the workers have to meet a certain amount of quota of individuals that they reintegrate to the community. Lots of times they're just pushing people through the process that aren't even appropriate to live on their own. People that didn't even really pass the evaluation process, but they just need the numbers, so they let them try out the program, which again has caused issues. Psychiatric medical needs aren't monitored as needed, again, because of the overwhelming caseload. They're not following up with them as necessary. So that causes issues of not being compliant with medication, not taking care of their medical and psychiatric needs, not going to doctor's visits as they should. Community support is not established. A lot of these people in the program, they go into it and they don't have any friends or family in the area to provide any support. So without the consistent visits from a worker, they're kind of on their own. And then housing options are in unsafe areas. A lot of the areas are lower income and have lots of violence and drugs around them, which especially a lot of them who have dual diagnosis of substance abuse issues in the past, this is a very bad situation for them to be in, and it has definitely caused problems. I know we saw in several of our clients that we worked with at the facility I was at, we saw these issues time and time again. People that would be put in this program who were not prepared to, but we weren't able to have a say-so in this, and they definitely did not succeed. Some of them ended up being rehospitalized. Some of them ended up getting really sick. Many of them just returned to the facility because they were so unhappy where they were, or there was an extreme decline in how well they were doing, and they started to experience symptoms they hadn't experienced in years just because it was so unorganized and they didn't have the support that they needed. We had some serious cases also with individuals getting back into substance abuse, or we even had a woman who went missing and the caseworker did not know for several weeks because the visits weren't being done as needed. So that was also a very extreme case, but a scary reality of what can happen in this process. So basically, the plans for the decree seem to have been implemented before the state was prepared to provide the services required. The needed funding simply wasn't in place to successfully implement these plans, and the decree came about at a time when the state was already experiencing ongoing budget cuts in areas of mental illness. From 2009 to 2011 alone, Illinois has cut funding for mental health services by about $113 million, cutting the mental health care budget by more than 30%. The number of mental health clinics has been reduced by about half in the past 5 years, and there are even plans for more closings in the future. These closings and budget cuts have resulted in negative outcomes, such as an increase in these individuals becoming homeless, incarcerated, without necessary medications or psychiatric care overall, requiring frequent hospital admissions, and posing a risk to themselves or others. Illinois gets a federal match for money spent on Medicaid coverage, and because there's no match for spending on mental health, the areas of mental health in the budget are often the first to be cut. The closings of mental health facilities and centers in Illinois is financially motivated because the closures are estimated to save the state nearly $20 million. And some speculate that policies and plans in place, such as the Williams Consent Decree, have become part of the state process to do away with mental health centers and IMDs for financial gain. The ongoing cuts and failure to provide adequate mental health services in Illinois has resulted in opposition from individuals with mental illness, their families, mental health workers, and other concerned citizens in the community. There have been numerous protests over the years calling for more support for this population. There's been multiple sit-ins at the different facilities and centers they're trying to close, as well as protests in the streets of Chicago, calling for more support for this population. Many specifically opposed to the Williams consent decree have written letters and made calls to the state, as well as attended the trial to express their concerns, especially as we have seen the outcome of the decree have not gone very well. Many families and individuals living in these facilities have gotten more involved in trying to express their concerns to the state and hopefully get some revisions done to this process. So what can be done? I think the plans for the decree are great in theory, but in need of much revision. There needs to be more thorough evaluations, consistent follow-up to ensure safety of the individuals in this, enough mental health workers, and overall funding to improve in all of these areas. I do feel that there are many facilities that have been around that needed to be closed down. They were poor conditions. It wasn't a great place for any of these individuals to reside, so that was necessary. But I do feel the state should put more funding into these supportive living settings and IMDs so they can be improved instead of closed. I think the reality is that a lot of people who have a mental illness can successfully live on their own in the community with support and resources available to them. However, there are also individuals who benefit from these IMDs in the state. And even a lot of individuals I worked with when all this was happening and the Williams consent decree came about, they were in a panic because they didn't want to leave the facility. A lot of them said living there had been the most stable they had ever been in their life, and that was the happiest they had been. And they didn't want to go back to living on their own or without that consistent support. So I do feel the state needs to find a better balance. Okay, so discussion questions. Do you feel the guidelines established by the Williams consent decree solve the housing issue faced by those with mental illness? Are there alternative ways in which state funding could be invested to treat those with mental illness more effectively in the community? Do you feel the stigma of mental illness may impact these decisions and laws regarding supportive housing, if at all? Do you feel the Williams consent decree has turned into another way for Illinois to take money out of mental health facilities? Well, thank you for your time and attention. I hope you learned something from this presentation, and I look forward to hearing what everybody has to say. Thank you.